I'm excited to be here with you. We're going to focus on just some stretches and movement to keep us limber and feeling good while we're at our workstations. So I have my chair here. There's such a connection. Often we start with just stretches, but there's such a connection with joints and muscles. So we're going to start with just getting our joints moving, and that sort of primes our muscles for some stretches. So since we sit fairly statically, kind of in this mid-range all day, we're just going to start with dropping all the way down into a slouch. Drop your head, slouch your back, come as far forward as you can, open up that spine in the back a little bit. And then we're going to move on up into the opposite direction. So you're looking up at the ceiling and arching all the way back. And we'll just hold here for a second and then come back on down. So we'll do maybe 5 repetitions of this, just slowly like opening up those joints, kind of feeling any of that stickiness. We can come back on up again. And I just find that it's so helpful to get all the way into those end ranges because we don't get there. We don't get there very often. We'll come back on up again, 2 more repetitions. And you're probably starting to feel a little bit of the tension that you've got. We'll come back on down for our last one. But don't worry, all those tense spots that you're finding, we will get to them. Good, so that's good. You're starting to feel loose in the spine. We're gonna get to our neck first. We're gonna kind of start and work from the top down. So oddly enough, when we're sitting at our desks, we come forward, we feel like we need to be close to that computer, and it puts a lot of stress right at the base of our skull. So we're gonna start with the most attractive stretch you've ever seen. You're gonna keep your eyes level, chin level, and you're gonna come straight back. You're making as many chins as possible. It's like maybe the only time that that's your goal. But that's gonna give you a little stretch right at the base of your skull. I'm gonna flip sideways so you can kind of see this. So this is a gentle stretch here. If you end up with tension headaches, this is a really good one to start loosening that. And you can see that I cleverly hide all of my chins with my fingers. If it feels good to give a little extra push there for a little extra stretch, you can. If this feels a little bit uncomfortable, those joints may be just a little stuck, and that's okay. You can sort of bump into the discomfort, and as long as it goes away when it comes off of it, that's fine. That's your body saying like, oh, this is tight, but it's not like harmful. So anything that we do today, if you bump into a little discomfort, as long as when you come back to a neutral position, that discomfort fades away, you're good to go. I don't want you to feel worse for anything that we've done. So if it doesn't feel great to you, just go mid-range, modify as you need to. All right, we're gonna stay up at the neck here. Lots of us carry all that tension right in the tops of our shoulders. So I'm gonna have you start with bringing your left ear down to your left shoulder. Try and keep your face right at the screen. And you should feel this all along the top of that shoulder. If you feel like you need a little more, you can take your right hand and sort of hold on to your chair and even lean away a little bit if that needs a little bit more work for you. But just these nice long, slow holds are gonna help lengthen those muscles. And then from this position, we're just gonna drop our heads down like we're looking at the floor. Or, you know, do you remember those Sure commercials, the deodorant commercials? This is the Sure stretch move. And this is you should feel this a little bit further back on your neck, but also one of those muscles that very commonly just gets tense when we're working at our computer. Just gonna hold here. Good, and then we're just gonna come right on down, chin to the chest. You can keep a little bit of extra pressure here. You don't have to really pull. We're not trying to force anything, but just a little bit of extra tension to encourage those muscles to relax, to lengthen. Good, feels good. If you tuck that chin under a little bit more, you'll feel it all the way up to the base of your skull. And then we're gonna just move on over to the other side. So we're gonna start again, looking sort of down at the floor, nose towards your armpit. And again, you should feel this base of your skull down to the shoulder blade. Just the weight of your hand, giving a little bit of a stretch there. Good. And then we're gonna bring our head back, facing the computer screen again, and just ear to the shoulder. And same, just the weight of your hand is usually enough. Again, you can take your opposite hand and kind of hold on to the bottom of your chair. And breathe. I loved the stuff about mindful breathing in the session before this. It's really helpful. As you exhale, your body reflexively lets go of your muscles to drop that rib cage. And so as you're stretching, focus on those exhales, and that's going to give you just a little bit more out of the stretch. We're going to keep working our way down the spine. So we're going to work on some thoracic rotation. So you'll take your left hand. If you've got a chair with arms, you can reach back to the arm or the back of the chair, and you're just going to twist here. You can take your right hand and put it on your left knee and just give a little rotation. Go ahead and take your head looking over your left hand. I'm going to keep mine here so that you can hear me. But you're going to get a nice rotation all the way up from the bottom of your spine up through your neck. And again, it feels so good to get into that end range. We just don't move all the way to the end very often, but our body is made to do that. It's made to move. Good. And then we'll slowly relax out of it, come back to straight, and we'll do the opposite. So we'll take your right hand, either back to the arm of your chair or the back of your chair, left hand on the right knee, and give a little pressure, pulling all the way into that end range, looking over your right shoulder. Feeling good and mobile. Excellent. We're gonna stay in the mid back. This is one of my most favorite stretches for that between the shoulder blade area where everything gets so tight. So you'll wanna scoot to the front of your chair for this. You're gonna reach around your body with your arms, like you're giving yourself a hug. I call this the bear hug stretch. And you're really kind of pulling your shoulder blades away from each other, pulling them forward. And then from here, you're gonna lean on down and feel that stretch all the way down. Feel the pull between your shoulder blades and all the way down into your back. But again, this is an area where we carry so much tension and we rarely bring those shoulder blades all the way forward. And a little bit of self-kindness, like we just talked about in the last session, with that hug and some breathing. Feels so good. Good. We'll have you come on up again. We're gonna keep working our way down the spine. I'm gonna have you take your right knee. You're gonna lift it up if you're able and bring it across to your left shoulder. Doesn't have to be high, and you can do all the lifting work with your arms, but you're gonna feel this a bit in your low back and down into the hip. This gets some of the deep hip muscles. Good. And again, we just want to do nice long holds. Our muscles have cells that are like sensors to them, and they tell your muscle how long and how tight is normal. And we can reset those sensors by just doing these long holds. Good. And then if you're able, I'm going to have you cross that ankle onto your left knee, and you can give a little push there if that feels good. If you need a little bit more from that, You can just lean your trunk forward. And again, you should feel this all in that right hip, into the low back just a little bit. We develop so much tightness in our hips with all of our working from home. Good. Good. And we're going to switch sides here and do the opposite. So same thing, your arms can do all the work as you lift. You can bring that left knee up and then pull over to the right shoulder, getting into that hip and the low back a little bit. I'm a therapist. I teach people to stretch every day. So I get to do this often. But I was at a conference myself a few months ago. And I'm gonna have you bring that ankle across your knee, and you can give a gentle push on your left knee, lean forward if you need a little bit more. If upright feels like enough, that's fine. But I went to a mobility session at this conference, and I'm a therapist. I know about stretching, but I've been working from home just like you have for the past 2 years. So I went to this mobility session and I could not believe how stiff I was. And so I myself had to commit to 10 minutes of stretching, like 4 times a week. And it has been so helpful in loosening up my hips and my back, and easy. And, you know, we know things that we think we're immune, but it's not true. Our bodies adapt to what we do. All right, we're gonna do a seated hamstring stretch, and then I'm gonna invite you to stand for a few stretches with me. So again, I'm gonna just turn sideways so you can see me easily here. You're gonna be on sort of the front of the chair. We'll start with your right leg. You're gonna kick that leg straight. Get your knee as straight as you can and keep your back as tall as you can. You're just gonna lean forward. You can put your hands on your knee if it feels good to support that way. Excuse my dog. Work from home is actually one of my favorite things. I get to see all of my patients' pets, cats in particular, often are walking across the screen. Good. And then you can pull your toes up. You'll feel that down into the calf, waking up the whole leg. If you can reach, you can give a little pull with your fingers. If you can't reach, it's okay. Remember that I have been doing daily stretching now for 4 months, and it's actually my job to be able to do this. So if you can't get there, that's okay. Good. And then we'll switch sides here. So left leg is going to come all the way straight, knee straight. You can put your hands on that right knee. Back nice and tall as you come forward. You're just gonna feel that stretch there. Even some deep breaths in this position to just help keep relaxing. And as you feel your body give and loosen, you can take up that slack and lean into it a little bit more. And then we'll pull those toes up. If you can reach and you want to give a little pull with your fingers, that's fine. If just the act of pulling your foot up towards the ceiling gives you enough of a stretch, that is fine too. It feels good to get into those muscles. Excellent. So I'm going to invite you to stand with me, and we'll try just a few more things, and then I will turn it over to Julia. So as we're all sitting, we're sitting at work, we're sitting at our computers, our hip flexors get so tight. In my career as a therapist, I have never seen so many tight hip flexors as I have during the pandemic. So we're gonna start in kind of a split stance, so feet apart. We're gonna stretch the leg that's behind. So for me, my right leg is back and toes pointed forward. Here's the key. You may have done this in the past, but this is where you're gonna get it. You're gonna tuck your hip kind of under, tuck that butt under, and that is gonna take up the slack in that hip flexor. And then if you need a little more, you can lean forward. You can bend your front knee and kind of shift forward, or even tip your trunk back a little bit. But if you just leave that hip, you're gonna feel like, gosh, I could go forever. So tuck your hip under and hold that. You should feel it right in the front of your hip there. maybe it down into the thigh just a tad. But these hip flexors get so tight, and they attach up on the front side of our spine. So if they're tight, they can really impact your back. Getting them nice and loose is really helpful. Good. And then we'll switch sides. I'm just gonna turn around so that you can see me again, but you can stay facing the same direction. So same thing, split stance. You're gonna tuck that hip under. And then if you need a little more, you can lean forward. I'm gonna put that weight on the front leg. Back leg is staying straight. If you need even more, you can just lean your trunk back a bit. But the whole time we're trying to keep that hip tucked under. That's really gonna help you take up that slack in that muscle. Feel it right there. This is one that I would just encourage you to do. You can do it while you're brushing your teeth. You can do it while you're waiting for your coffee to percolate. Anything. Okay, and then we're gonna end. I know so much forearm tension is developing because we're sitting in maybe not optimal. So I'm just gonna have you start with bringing your forearm up. You can play with the angle on this if it feels good to kind of rotate, find the spot that's tight, and that's where you need your stretch. So you can kind of play with that and feel that there. And then we'll do the opposite. So palm down towards the floor. You can give a little extra pressure, and same thing. You can kind of play with the angle and find the area that you're tight and hold it there. All right, and then let's switch hands. We'll start palm up again. So you're just kind of bringing that back, feeling that on the underside of your forearm, finding the angle that works for you. And then we'll drop that palm down towards the floor and feel the top of your forearm lengthening, stretching, relieving some of that tension. Great. We have so much more that we could do. This is just kind of getting into it, into the most common areas of tightness. If you've got questions though, I'm going to turn it over to Julia so that she can give you a little bit of an overview of Omada for joint and muscle health, and can answer some of your questions there. Thanks for stretching with me today.
Thank you, Anna. Really appreciate it. I feel so much more flexible and awake. So thank you very much. We did have one question come in, and I think, you know, this will really play into the Omada for joint and muscle program that I'm going to talk about now. But, you know, Lynn asked, are there any good exercise shows or apps media that are free and for someone older, like the exercises that we did today? Part of the Omada program has a free prevention program that I'm going to talk about. So that's going to be a great option for you if you are eligible to join. So I'll talk about that in a minute. But anything else that you usually recommend to folks outside of the Omada prevention program?
Well, that is what I was going to say to Julia.
Okay, great.
So all of our programs were created by physical therapists, so you know that they are really giving you a holistic approach to whatever body part you pick the program for. So I would encourage you to check that out. There are tons of free stretching apps. You know, the Peloton has a free app, and their 10-minute full body stretches are really great. Doc Jen Fit has a free platform. She's a physical therapist, so that's, you know, injury specific. But there are tons and tons of good resources out there. But I'm biased. I'm going to say start with Omada and our prevention programs, because they're gonna target what you need.
Awesome. Thank you so much, Anna. And to kind of go off of that, I'm going to do a quick program overview for you all if you are newer to hearing about Omada for joint and muscle health. So let me go ahead and share a few slides to walk us through this today. All right. Can someone give me a thumbs up if they can see my screen? Okay, fantastic. Thank you so much. Awesome. So Really excited to be here with you all, and thanks again for having Anna and I. You may be familiar with the Omada name, so just wanted to, refresh your memory. We do have the Omada for Prevention program and diabetes program through Medica, and we have recently rolled out our Omada for musculoskeletal, which is the program that Anna supports as a PT. It's available to a lot of folks starting in this year in January, and for some more throughout the rest of the year as you come onto the medical plan. So really, really excited for this new offering. And I'm just going to do a quick overview today. So kind of, why Omada got into this space. It really is an extension of our core programs and our core beliefs in behavior change, working with a digital platform. We realized that, 1 in 2 adults have an MSK condition, which is just really kind of a mind-blowing statistic. And it also has a really high healthcare cost because a lot of, injuries can just grow and end up needing, more surgeries. And we wanted to prevent that in advance with a lot of what we're doing. So how can we get people to access physical therapy easier and quicker than maybe they have in the past? And, with that, oftentimes when patients get an injury, it can take a long time for someone to find treatment, and it can be expensive, and there are a lot of hurdles and barriers to accessing care. Maybe you go to your PCP and then you're referred to a specialist and you have to make an appointment with them, and it's hard to schedule something during the day because you're at work. Maybe the clinic is far away from your home. A lot of different things that can be a barrier to getting the treatment that you need. And so, with the Omada program, we saw an opportunity to bring physical therapy to the digital world and to your phone, so that you can access care right in your own home whenever you need it. People that, patients that join the MSK program get access to a physical therapist within 2 days of joining. They're able to schedule appointments through their phone in the time that works best for them. And we just want to make it really easy and accessible for people to get the help that they need. Since we're all home and doing a lot of stuff these days that requires more flexibility, I think this is a huge added benefit to a lot of us. And so with that, we know that every person is a little bit different and has a unique situation, injury that they may be struggling with or want, support from a physical therapist. And so our program has helped design care plans for each individual, designed by a physical therapist that are specific to each individual's needs. It's not a one-size-fits-all program, and we recognize that, especially going in. So we have a full spectrum of solutions and programs that you'd be able to join with the Omada for Joint and Muscle Health program. So it is going to start with a risk screener. So when you join the program, we take a risk screener to kind of assess your injury. If you don't have an injury, we do have a program for you. This is our prevention program that I mentioned earlier. And this is really for folks that are looking to kind of get ahead of it, to prevent injury, to do some of the stretching exercises like we did today with Anna. We're all tight, we're all kind of, sitting at home and could use some more flexibility and mobility. And, maybe you can sense a potential injury coming on and want to get ahead of that with some of those exercises. So the prevention program is free of charge and just available for you to do on your own time in the capacity that makes sense for you. And again, all done on your mobile phone. If in the risk screener there, we would require some additional clinical evaluation for you, depending on the responses to your intake survey, you would then be routed to a video consultation with a physical therapist. And that again is right through your mobile phone. They would kind of assess your injury and make a recommendation on a care plan that's best for you. We have a couple of different pathways that you could be directed to. Kind of the self-guided care pathway, which is for those with a low risk acute injury that, really is something that you could likely get some exercises and manage on your own, not as, intense of an injury, and the PT will put together a specific care plan for you to kind of do on your own time. And then we also have our kind of most common pathway, which is the high risk, acute, and chronic pathway, which is the PT guided care plan. And this is when you would, meet someone like Anna, who is your physical therapist throughout your time in the Omada program. They're going to design a care plan that's fit to your injury and specific to your, issue, and, walk through that care plan with you on a regular basis, provide you with exercises, provide you with, video consultations throughout your time, check-ins, talking with them one-on-one. They're available to you on a regular basis in your pocket as needed. And then, of course, in the event that there is a severe case with an injury that couldn't be addressed digitally, we would recommend that seek in-person treatment as well, because that does happen when you would need to go in person also. So a lot of different opportunities to access the Omada for Joint and Muscle Health program and create a personalized care plan that is specific to your needs and issues and condition that you're dealing with and the injury that you have. And so just a couple of little details about what you might see. We're really excited about the impact that we've seen from our program. Some of the outcomes that you can expect from joining Omada is, reducing that pain that you might feel in the specific area and improving the functionality of your injury area as well. So, increasing that range of motion from your arms, your limbs, your fingers, whatever that might be. We've saw that 98% of individuals that go through the Omada for Joint and Muscle Health program showed improvement in the area of concern that they came in with. So really awesome improvement rates that we're super excited about. And then, kind of when patients are diagnosed with a licensed physical therapist in the program, they're with that physical therapist their entire time. So you've got that one person that's sticking with you through your journey. And, we really think this is important. They understand, your injury, what you're going through, and you can build that connection with them. The care plan is, again, personalized, easy to follow. It'll look kind of like this screen you'll see here on the front. And on your mobile phone. So you can bring it with you to the office if you're traveling to do, your exercises wherever you are. And then you'll also receive a welcome kit with some bands, exercise bands that you can use for the exercises that are recommended for you and, for your care plan and the tools that you might need to do those exercises. And then lastly, some final kind of, snapshots of what you might experience in the program. Patients have unlimited access to PT video visits. And again, this is right all through your mobile phone. You can see the second screen is the daily progress page. So, what's recommended for you to do today for your exercises, the workout, it's rejuvenation, stretching, whatever that care plan specifically is for you. That daily action plan is laid out on your screen when you log in. We have 3D animations of the exercises to really help guide you on how to do those exercises when you're at home and, maybe you're unsure of the specific movements that you're supposed to do. The 3D animation tools will really help you do that. And then lastly, I think this is one of my favorite features, the async video assessment. So this is really a cool tool. So you can record yourself doing the exercises and share those back with your PT so they can review the exercises, make some assessments, connect with you on if you need to make any adjustments to form so that they can ensure that you're doing the exercises properly and most effectively for improvement. So a lot of cool features that you can get all within the app. And so now I want to talk quickly about how you are able to access the program. All right. So you may be familiar with this page. This is our Omada page for MHC. You're going to go to omadahealth.com/MHC to access this program. When you click Get Started, you'll be able to choose from the program that you're interested in. One of those options now is the Joint and Muscle Health program. When you click that kind of tile that you see there, you'll be directed to a more specific MHC page for MSK. And this just really gives you some additional details on the program. It's a little bit different, so we wanted to provide some more information here. You can learn a little bit more about the program before jumping in. You'll get click started and then be taken to that risk screener to apply. One last thing here that I think is important to share is that on this page as well, on the bottom, if you scroll down, we do have our cost calculator, which really helps to understand what the specific costs of the program might be for you depending on your health plan benefits. So you can put in your information, your Medica member ID for your health plan, and that will give you an estimate of what the potential costs would be for a physical therapy consultation and then the PT-led recovery program as well. So you can get an idea through that cost calculator on the main page. And then lastly here, just program eligibility. There are some different requirements here for the MHC population. So in order to be eligible to join the Omada for Joint and Muscle Health Program, you must be at least 13 years or older to join, enrolled in a Medica Choice Passport plan, and then reside in one of these 6 states: Iowa, Minnesota, Missouri, North Dakota, South Dakota, or Wisconsin. So take a look at those eligibility requirements. If you do fall into that category and are interested in joining and taking a look, we really encourage you to do so, and are really excited about offering this program to all of you as an added benefit. And to close us out here, I did just want to share a quick 1-minute video so that you can see what an actual experience looks like for someone who is going through the program. So I'm going to go ahead and click play, and hopefully this will work.
Unfortunately, you can't overcome recurring joint and muscle pain through minor adjustments or willpower, and finding convenient, affordable treatment can be frustrating. Until now. With Omada, you enroll in our virtual program for joint and muscle health in minutes, and see your licensed physical therapist within 48 hours, all from your phone. Your dedicated physical therapist will diagnose your condition and create a custom recovery plan right in the app. Everything you need is delivered right to you. Our app guides you through each exercise and records your movements for your physical therapist to assess, putting you on the fast track to recovery. Begin your journey today, all from the comfort of home.
Awesome. So thank you all for the time to share a little bit more information about the program. I know we're coming right up to the end of our section. If there's any questions, burning questions, I'm happy to take 1 or 2 in the chat while we have Anna with us. We're so lucky to have her here today as an actual physical therapist that you might be assigned to work with if you join the program. She is based out of your area, working with those in Minnesota. So you may meet her, if you join the program. But any questions in the chat? Otherwise, I'll pass it over to Chris and Hannah.
Questions come through. Julia, thank you so much for that nice overview again of joint and muscle health. And Anna, those exercises were wonderful. So thank you both.